from the Texas Medical Association Political Action Committee. For all of you.
Well, Dr. Bassett, thank you so much for having me here tonight with the FortBend Medical Society and for this. Thank you. Running campaigns is not cheap, and you got to get your word out. You got to do it through social media and through mailers and different things. So this will be put to very good use, and I'm honored by the support of the Texas Medical Association and great physicians here in Fort Bend County. I've had the opportunity today to skip around to a few tables. It's amazing, the energy in the room, and I'm reminded when I meet with a group of physicians that the level of IQ is very high, and the opinions are too. And so, I love that because we as a society want to go to see our physicians and know that they have great confidence, that they've been trained well, that they know what they're doing, and they're practicing at the level of scope that they need to be. And so just a little bit about my history. I was elected to the Texas House in 2001, and for the ladies in the room, I was pretty young, and I had a daughter that was 11 months old when I announced. And so, I juggled that career and being a mom, and I was always a mom first. Always a mom first. Everything else comes second. And so, and for the ladies in the room, I was only, according to our estimations, only the third woman in Texas history to have a baby while I served. And so I think I broke some glass ceilings, and I know a lot of pediatricians in the room. That we can do pretty good while we're still pregnant, and then we can be pretty good moms while we're still having a career, as long as you keep in mind that you keep your priorities straight and families first. And so along that, about 2009, I was named the chair of public health. And when you say fresh eyes, that is what you got. I had never filed a bill that had gone to the public health committee since serving. And that was pretty astonishing. But getting to go in with fresh eyes is a huge advantage because you can listen to both sides. You don't have filters. And as I talk to the pediatricians and to our family practice doctors and even our ER docs, no offense to our specialists in the room, but you've got to be able to recognize anything that walks in through that door. And so I've spent a good portion of my serving the people by being able to listen and show discernment and listen to professionals, all sides of it, and try to make the best policy for the state of Texas. So you have my pledge and everything within my fiber that I will always be that person that listens to all sides and works with the committee. So I chair Health and Human Services. I want to thank the Lieutenant Governor, Dan Patrick, for naming me the chair of Health and Human Services in 2019. So I've had 2 terms there, and I also chair Article 2 in the budget, which is where all the money is. In fact, it's the largest part of the budget, Health and Human Services. And this last session, I felt like it was the first session that I could really start to move the ball. And we did things like we extended benefits for pregnant women beyond the 2 months. We did things for children that I think are extremely important. I've heard from some of you about insulin. This free market loving Republican carried a price cap bill on insulin because for 100 years we've been waiting for that generic that really competes. And when the markets go astray, that's when government should step in. And so Texas has one of the strongest price cap bills on insulin now at $25 per script. With Dr. Oliverson in the House, we also passed a bill, HB 18, that is going to allow those that are not covered by insurance to help them with pharmaceutical costs as well. And so let me know, I want y'all to know that I know everything starts with your pen. You have the ability to move the needle, but then there are roadblocks when you know what's best for a patient, but they can't afford it. And it's a maze that y'all work through. And I just want you to all know how grateful we are for that. And the maze of March the 13th, 2020 and beyond was something that I never thought I would see. In theory, there was always the great pandemic that was gonna happen. That was 100 years ago, it's never gonna happen again because science will always stay ahead of it. But science couldn't stay ahead of it. But what you did in dedicating your lives to serving patients in the hardest way was incredible. And so I think that I stand here as a representative of every senator in the state of Texas, and each senator represents just slightly less than 1 million people and more than a U.S. congressman. We say thank you, because it was something that I never thought I would see in my lifetime. And I hope that the lessons that we learned we'll never see again in any of our lifetimes, or our children's lifetimes, or our grandchildren's, or their children's lifetime. And so this is what I want to say. We need your input. We talked about scope of practice. Now listen, to all you men, you don't have as much passion as these women over here, okay? You just don't. I mean, that's just how we're wired, right? You know, my husband said when I was walking in, he had been traveling on business, and he said, "Where are you? What are you doing?" Both of our children, one's out of college and gainfully employed, and another one's a freshman in college, and so a little bit different with our empty nest syndrome. And I was telling him about my day, and he goes, "I just don't know how you do it. I just don't know how you do it." And I go, "Because I'm a woman, I can do it." And so, having said that, is we talked about scope of practice. Okay, I bet every doctor in this room has an opinion on scope of practice. But I want you to know that the general public wants to be able to call and get an appointment with their family practice doctor. Everyone wants to be able to, when they're referred to their specialist, to be able to get in. So our challenge is, what do we do? How do we meet these needs? And what is the best system that is going to produce quality care? You know, I need to be seen in a situation where the practitioner is properly trained to make the diagnosis that starts a series of events, as we all know, right? And so with that, you know, I just want y'all to know that whether it's Texas Medical Association, here, the FortBend Medical Society, your voice matters. But it only matters if it's heard. And that's the challenge. So I want to thank you. As I go around the room, so many of you were born and raised here. You graduated from FortBend ISD. I met with FortBend ISD new superintendent. We had a great conversation today. My Senate district shifted a little bit away from Katy and Fulshear, kind of more to Sugar Land. Sorry, Meadville. I wanted to keep you. But I went from 21 counties to 18. So if you don't see me in Fort Bend County every day, I can assure you I'm somewhere on the road. On Saturday, I will travel about 500 miles making the Republican conventions. That's what we do. It's a district that I think is representative of Texas. I have some of the coastline, I have suburban Texas, I have very rural Texas, and everything in between. I have Harris County, I have Montgomery County, I have Fort Bend County. I go all the way to Rockport, Fulton, in Senate District 18. And so, which I'm not counting, but that's about 223 miles from my house. And so that's just one way. When I make that round trip, it's 450 miles. So having said that, I feel blessed to do that because I get to see all of Texas. and make it all work. So as the chair of Health and Human Services, you know, last Thursday I chaired a committee on child protective services, and what we saw, the breakdown in Bastrop, Texas, that, you know, led to potentially some exploitation of children in the state's care. Unacceptable, absolutely unacceptable. And we have to figure out how those systems break down, right? But then on the flip side, I'm dealing with healthcare issues that involve your life. And so, you know, Dr. Bassett brought up an issue. You know, he said, gosh, you know, I really want to help somebody. How's Victoria? And I go, well, I think Victoria's fine. Well, it wasn't fine during the pandemic. I know Belleville, Texas, I have a nephew who is an ER doctor. And he would call me and go, Aunt Lola, I need your help. I can't get this patient placed anywhere. He is going to die in this hospital in Belleville if you do not help me get this transfer. And I think from that, we can do some really good work. How do we do those transfers? How do we set up better systems? How do doctors help doctors? Dr. Bassett, isn't that how you said it? How do doctors network with doctors? How do we get past the hospital administrators? How do we save those lives? I think that's hugely important. And so, you know, I look back on my career and the input that I received that hopefully I turn into action, like, for example, Texas Children's. I know I met a pediatrician that practices with Texas Children's. I literally went on a tour of Texas Children's when I was serving in the house, and I was sitting there looking at your NICU, and I said, so what is, you know, how do we classify NICUs like ERs? You know, ERs are, you know, level 1's the highest, level 4 is the least highest. I mean, how do we do that? And one of the hospital administrators, who ironically I went to college with, just happened to be, she looks at me and says, it's space requirements and the number of plugs you have in a room. And I go, what? And so I turned that into HB 15. We had a series of bills that has turned us now that we have NICUs that are graded on levels. Level 4 being the highest, opposite of our ER rooms. And I think that has bettered our healthcare delivery system. So with you, I will tackle any problem. Sometimes I recognize them and take them on as my personal pilgrimage to help y'all while y'all are busy practicing medicine. But I look forward to working with you. And with that, Dr. Bassett, just a little bit about, you know, my background. I'm happy to take any questions tonight, or you know, I just can't thank you enough for the true, I call it the honor. Every day, you know, I wake up and say, thank you, Lord, for letting me have the opportunity to serve people.
Thank you for those kind words. And please ask away, and we look forward to working with you in the coming years and meeting with you on a regular basis.